Hi, I'm Dr. Samantha Slotnick, and I'm doing some work which I've been referring to as lens-based postural therapy. And I had a patient who gave us a wonderful demonstration just this week about the power of lenses and how it changes her capacity for doing exercises which were prescribed for her by a person who does physical therapy with a postural restoration influence. When she is doing this exercise, it's synchronized with her breathing. So there's a component that's engaging her body, her lungs, her diaphragm, communications through the torso, and this exercise is prescribed to her as a way for her to correct some of her postural imbalances. So you're going to see that first. Show me the exercise.
Oh.
Wow.
Yeah, it's hard.
Okay. So in the next video, you're going to see the same exercise, but here she's wearing the multifocal lenses, and I've just added that quarter diopter of cylinder. I'm highlighting her sense of the ground. I'm giving her a sense that the ground actually comes downhill a bit for her, so she has an ease in her body. It reduced tension in her gait. And so I said, this looks so much better. Let's see if you can show me an exercise where we employ this lens, and that little difference, let's see how that changes your power. Okay. Wow, that looked easier. Also easier. Also easier. Wow.
That's easier.
She's actually taking in more air. Her back gets higher off the ground. Her whole sternum is more expanded. She has such an easier time doing the exercise. She's actually talking to me during the exercise. So she has more airway availability. Now, she's actually dropped astigmatism power since we've been working together, and since she's doing all of these other exercises which reduce tension on her body. So in addition to giving her a lens that's a multifocal masking that astigmatism, the other goal that I had was to help her feel more grounded and stable with a firm sense of the ground and the floor. And so usually that kind of a lens gives some attention to this horizon. So if I were to try to provide that, her contact lens is helping her see more clearly. We're actually in the way of me being able to provide that for her, because her contacts were drawing out this vertical aspect of her visual field. So how is it possible that she's able to get that much more power with such a slight prescription? I find it fascinating. I'm excited to share it. I have some thoughts about it. I do present some of this material in lectures. There are some lectures on lens-based postural therapy and some of those lens applications that are really intended for clinicians. There's going to be a link below in the description if you're interested on a clinical level of going there. And if you're a patient who's looking for other providers and hoping to get access to this kind of work, you can take a look at my website just to get access on a patient-oriented level through an introduction of this integrative mode of work. Thank you for your time and attention and sharing our excitement with this multimodal way of working with patients.